Okay, I'm delighted to say I've been joined this morning by Dr. Cliff Richard, the Chair of the Halton Clinical Commissioning Group. Good morning, sir. How are you?
Very well, thank you.
Excellent. And Simon Banks, Interim Lead Chief Operating Officer of the Halton Clinical Commissioning Group.
Good morning.
That's a fine job title, Simon.
Yes, hopefully I can live up to it.
Nice and long. Can you tell us a little bit about your role?
My role is to support Cliff and the other clinicians in getting the Clinical Commissioning Group to what we call authorisation. That means it's set up as a statutory body and we'll be able to take over the commissioning of healthcare for the population of Halton as of April 2013.
Right. A lot to do before then?
A lot to do, but very achievable.
Excellent. And Cliff, you're the chair of the group. Tell us a little bit about what you're going to be doing over the next 12 months.
Well, I see my role as providing some clinical leadership,
right.
Particularly to get us through the challenges of the coming months, to put us in a position to be fully authorised at the end of March 2013.
Right. And you're a GP at the moment, sir, is that correct? Is that right?
I'm a GP at the moment. I've been a GP for the last 29 years, almost.
Excellent. And you, Simon, what's led you to this point in your...
There was opportunity to come and work within Halton. I've worked in Halton now for, well, most of my career in and around Halton, 3 years directly in Halton.
Mm.
The opportunity to work with Cliff and other GP colleagues within Halton was actually too good to miss. Really proactive bunch of GPs, very, very focused on promoting the health of the population and making changes and working closely with the Borough Council in Halton. So, really exciting opportunity, I think, drew me in.
So the health work framework, or the health framework I should say, it's changing both nationally and locally. Can you tell us, what does this mean for Halton and St Helens?
I think the most obvious change is that it will be changing from the Primary Care Trust, which are the healthcare planning arrangements that exist at present.
Yeah.
These will be changing into what are called clinical commissioning groups, and that change, with the passage of law, will take place at the end of March 2013.
Right.
The main change is really about putting clinicians, particularly GPs, at the heart of these arrangements, with the expectation that we'll have better, more finely tuned, more sensitive decisions about healthcare planning made.
Right. And as a GP, do you feel empowered by that? Is this an exciting time for GPs, or are you a bit tentative?
Empowered.
It's a voluntary sector buzzword.
I think I'd echo Simon. I think it is an exciting opportunity.
Yeah.
I personally, I don't see this about GPs being empowered or about power at all.
Right.
I think it's about making common sense decisions.
Correct.
I think it's about making all of those right connections between all the various bits of the health service, and particularly with social care and the local authority.
Yeah.
And I think there are key connections, particularly with our communities, the people of Halton, the GP practices of Halton, and I think the new arrangements will hopefully make more better sense of those arrangements and improve things.
Fantastic. Simon, tell us about clinical commissioning groups. For a man on the street like me who's not a healthcare expert in any way.
I think that's best answered by Cliff, because
Right.
actually they are clinical commissioning groups, and this is about changing the leadership about how we deliver commissioning going forward. So Cliff's best place to answer that, I think.
Okay. In my view, whatever healthcare planning has been in place for many years has not quite done the job.
Right.
I think it's been distanced slightly from people and patients and communities, and I think clinical commissioning is an opportunity to put clinicians, particularly GPs, much more closer to those decisions, acting as a proxy for the population, for the people of Halton.
Yeah.
Really, we want to absolutely know what the people of Halton want, and hopefully be able to mould services around that. And it seems that GPs and other clinicians are in the van of being able to take that opportunity.
Yeah.
So I mean, it's essentially new legislation has been brought in, receiving rule of assent around about now. And that legislation removes the old primary care trusts who were responsible for the delivery of health care. Was previously for Halton St Helens about 320,000 people. What it does now is make that commissioning body much more local, so it will be covering about 128,000 people who are registered with GPs,
Right.
the whole 119,000 of the people who live in Halton.
Yeah.
And from April next year puts the Clinical Commissioning Group of GPs, nurses, secondary care professionals and local people, so we will have local people on the board as well, lay people, puts them in charge of some of the key decision making.
And who better to know what's right for the people of Halton than GPs and, as you said, the people of Halton themselves?
Yeah. And Cliff and his colleagues who are currently members of the governing body and the 75 GPs we have in Halton, they know their patients extremely well, they know the needs of the local community, and they're a great asset that actually our vision is about harnessing that and working with local communities to improve health and well-being.
An expression I've heard a lot in the voluntary sector over the last couple of months is people talking about being ready for GP commissioning. Mm-hmm. Tell us a bit about that.
I think the perspective and the message that's gone out is that it's all about GPs, but it's not all about GPs. GP commissioning and clinical commissioning is the same thing.
Right.
But there certainly seems to be an expectation, a willingness from the government that GPs are key players in this.
Yeah, absolutely. I suppose we might not know yet, but do we have any idea what the local priorities are going to be in Halton?
Well, we've actually done some work with local people. We had an event on the 28th of February. We also had an event with our practices on the 29th of February. Some of our objectives have to be given. So the government will not just say, there you go, get on with it.
Yeah.
There's priorities we've identified from the Joint Strategic Needs Assessment and from something called the Operating Framework, which is given to us by the government. So essentially, it's about, we want to prevent people from dying prematurely. That means work around cancer screening particularly. Mm-hmm. We want to enhance the quality of life of people with long-term conditions. That means giving people particular mental health issues, learning disabilities, chronic obstructive pulmonary disease and other respiratory conditions a greater control over their lives, so preventing hospital admissions as well. Yeah. When people become ill, we want to make sure they recover quicker, so we want to actually introduce better services for stroke. We want to ensure that we have better intermediate care, and intermediate care is what brings people out of hospital and home quicker. We want to make sure that people have a positive experience of care, so we want to work with healthcare providers about having zero tolerance around healthcare acquired infections and making sure their experience is a good experience of healthcare, and where it's not, taking steps to address that. Yeah. And within that, there's a lot of work we want to do around military veterans. Halton has quite a substantial proportion of people who've been in the military, and we want to ensure that those people receive the clinical services that are appropriate for them. Again, about having people in a safe environment, protecting them from harm, ensuring that working with the local authority, we have safe services, we safeguard vulnerable adults and children. And then we also have some things that are, if you like, not going to float the boat of many people in terms of the public, but they're things we have to do. So we have to deliver value for money. Of course. And we have to deliver financial balance, we have to manage our resources within our means. Yeah. And we also have to support and deliver system reform, and we mean that by we have 2 local NHS trusts that are going for foundation trust status. We need to support them through that. Okay. There's the transfer of public health functions to the local authority, which we're supportive of, and there's actually the creation of the Clinical Commissioning Group. Because whilst we're managing the system, and whilst we're still continuing to deliver high quality healthcare for the people of Halton and wanting to transform how that's delivered in the future, we have to establish a statutory organisation which is going to be scrutinised and monitored by the Department of Health, through the National Commissioning Board, by Parliament, by local authority, by local people. So it has to be a sound financial base, good governance, and actually be an organisation that people want to be associated with.
A lot.
Yes.
A lot on the plate.
Yeah.
I suppose that the key question that we, the voluntary sector, are always going to be asking is, how can we get involved? Do you see the voluntary sector helping you to achieve these goals?
I see the voluntary sector is extremely important. I mean, I think there's two themes that we would really want to try and achieve. One is that people only go to hospital when they really need it, and they go for what hospital can really do well. And we'd like to provide a raft of other services in the community to give other options, so that we don't, so that hospitals do what hospitals should be doing.
Right.
We're also committed to working with the local authority and whoever, and I think the voluntary agencies come in here, with trying to do what we can to turn around the illness, the burden of illness that our population has. To my mind, whatever health has been trying to do at people has not really got us to the position where we need to be.
Right.
We know that there are problems with obesity, alcohol, and people are living longer. We don't want people to be living longer in a longer time with ill health.
Quite.
And that doesn't help anybody, and in fact increases the cost for them, NHS.
Of course.
So I think we were really interested in finding models of community care, models of community involvement and engagement, where the community, people, find ways to help themselves, find ways to take opportunities to improve their own health, take opportunities not to worsen their own health, and I think local practices and health planning can support that. I'm not sure whether it can do it for those communities, for those localities, but we're willing to certainly help and play our part in that. And I can see a really important role for the voluntary sector in those kind of arrangements.
Definitely.
I mean, my first few years of my career were in the voluntary sector, and actually since then I've been involved in the voluntary sector in a number of ways, as trustee of a charity, and actually as a sort of participant in a family support group. So I know that the voluntary sector in Halton is very vibrant, has much to offer, and there's several ways. I mean, there's providing services to help us deliver the objectives I described earlier. There's providing information and advice about health services that the voluntary sector gets engaged in. There's also advocating for people who are involved in health care and social care, and supporting people who need that level, that voice, if you like. And there's also the great work the voluntary sector does in terms of lobbying and campaigning. So there will be areas where they would want us to make a change in the way health policy is delivered, or actually influence how we deliver healthcare services in a more appropriate way. So there's a great contribution the voluntary sector can make, and certainly we can create as many opportunities for them to do so.
I'm involved with a very small project out of a community centre in Runcorn, which is called the Runcorn Wrestling Academy, and it's professional wrestling, so it's not sport, it's what we call sports entertainment, but we think it's a terrific way of engaging young people that don't play football, that don't play rugby. They're learning about healthy eating. Obviously, it's a very physical activity, just like dancing would be, for example. So it's whilst I feel very confident that we're helping the health of the young people that come along, we're a tiny organisation and our infrastructure's not so good. What are you looking for in terms of, because the voluntary sector is made up of all different shapes and sizes, but if groups want to be commissioned, are the standards you're looking for in terms of how they report back, how the finances in order, that kind of thing?
I mean, there will be certain standards if you're willing to accept, say, an NHS contract, but that's some of the bigger players in the voluntary sector would that be more appetite for. And we have set some standards previously within the NHS for small to medium voluntary sector organisations about financial balance, the added value they can bring, and so on. But the groups that you're talking about, the sort of the one where you're fostering The Rock and the John Cenas of the future, then that's actually voluntary action at its very, very best. Where actually you're contributing to the health and well-being of a group of children and also their families as well.
Yeah.
Which actually we don't need to actively commission that type of activity. It's the activity we'd want to encourage, and working alongside the Borough Council ensure that we have the community assets in place to support that sort of activity. I run a junior football team in my spare time. That's improving the health and well-being of the 10 or 12 kids on our books.
Absolutely.
Doesn't do much for my heart rate. It's an example of voluntary action where you're actually providing people with healthy options to physical activity and also mental stimulation and the sense of being together. Yeah,
I played in the Runcorn League from the age of 7 till 16, and it's that, as you said, being a team, making friends, having a run round on a Sunday morning. It does wonders for the soul.
So we want to work with the voluntary sector, with the Borough Council, with all the other agencies to make that actually from the old phrase from cradle to grave. That those opportunities are there for people.
Absolutely.
Interesting. There is a research evidence that says if people display 4 characteristics, they actually live longer and they have happier lives. And you've described at least 3 of them there.
Right.
In that people who take regular exercise. Who have good positive relationships with other people, who have a willingness to learn and be inquisitive, and who display giving.
Right.
And those 4 attributes help us live longer.
Definitely.
So
that's a lovely thought.
Exactly. Yeah. So it isn't all about what health planning is about. It's what we all do in our lives to help everybody else.
Brilliant. Now, I'm a Guardian reader, and it was put to me once at a conference by our national association. The problem with our sector is we all read the Guardian, and it has been quite down about the changes in healthcare. Are you meeting a tremendous amount of cynicism? Is that misplaced? Is this an exciting time for health services in the UK?
I think it is. I think there is an amount of people have been clear about it, and that include GPs and the practices. There has been no huge opposition amongst the practices in Halton that I've perceived. I note the scepticism and the negative comments by many Royal Colleges, although the Royal College of GPs have now come around to supporting it.
Right.
I think most of the criticism, in my view, is about the area of competition and is opening up the NHS to privatisation. Maybe the jury's still out on that, but I and the practice, I think, much more interested in the other arrangements, in the development of clinical commissioning groups and the kind of things that we've been talking about. I'm really interested in what a Guardian reader is supposed to look like. I get it on a Saturday, so that makes me 1/7 of a Guardian.
I only get it on a Saturday as well.
But
I think the issue is governments are elected to take forward a legislative programme to put policy in place. This government has been elected, formed a coalition, put a programme in place around the health service, and it's now law. And actually the best way we can deal with that is to engage with it and shape it so it actually meets the needs of our local population, and it puts our local clinicians in the driving seat.
And debate over something as important as the NHS can never be a bad thing.
Closest thing to a national religion, I think, was it Nigel Lawson said.
Really fantastic. And I'm very grateful that you've taken the time to talk to us this morning. Before we go, are there any messages for the voluntary sector that you want to get across at this moment in time?
I mean, for me, it's keep in touch with the local healthcare developments, spot the opportunities that are there, think about the added value you bring. There's also, as well as spotting the opportunities for service provision, spot the opportunities for engagement and lobbying. We're going to have a Halton People's Health Forum we would like the voluntary sector to become involved in. There are people who are engaged in voluntary activity now who may want to be lay members on our governing body.
Right.
So there'll be some adverts going out around that very, very soon. And also, really we're thinking about maximising the integration we have with our local communities and with the agencies working across Halton, and voluntary sector bodies are very much key to that. And whilst we're not going to be bearing large amounts of resources in these financially challenged times, there is actually enough vibrancy and resource out there collectively where we think we can make a real difference to the health and well-being of Halton. And when I talk about Halton and Halton people, as I said, 128,000 people registered with GPs.
Yeah.
Not everybody should be regarded as a patient. So we want you to help us try and change the way we perceive health and health care, so we're more of a health service rather than trying to deal with disease all the time.
Wonderful.
I think the voluntary sector is very important, and I think these changes will hopefully raise the priority of the voluntary sector. I think GPs can see the value of them, they can see the benefits of patients, and I would expect that they'd have a higher priority in plans.
Wonderful.
But another message I would give out is perhaps a message of patience, really. As we started off early on in the interview, there's an awful lot to do just to get to organised. There's an awful lot to do taking on the statutory responsibilities, and if we're not looking as if we're active or engaged in various sectors, it's perhaps just because we're busy in other areas.
Of course.
And also what we're doing is building for the future. We need to spend time now to get things as right as we can, so there's a solid base and a positive future for all of us.
Brilliant. Will you both come back and take some questions from voluntary groups in the future if we do this again?
Yes, absolutely, yeah.
Fantastic. I'm very grateful for your time this morning, Dr. Cliff Richard, Simon Banks. Thank you for talking to Halton St Helens VCA.
Thank you.
Thank you.